Now, your adrenal glands can make sex hormones, and they can make sex hormones, but they actually make steroid hormones that go out into your fat and get made into estrogen. So there's some women, they tend to be on the heavier side, that they'll do just fine. But most women who have their ovaries taken out, they need hormone support, period. Okay. If a woman has a hysterectomy but keeps her ovaries, then she doesn't have to worry about getting pregnant. Okay. The guy's not hitting anything, because frequently women, if they have a hysterectomy, their uteruses will be enlarged and it's uncomfortable because he's hitting up against something, and so that discomfort's gone. Okay, so you can be much freer with sex and be able to enjoy it, but they have to have their ovaries. If they don't have their ovaries, their interest in sex is just going to plummet.
Okay.
Now the other thing is, let's say you just have a regular hysterectomy, okay, because you have fibroids and you have heavy bleeding. And I would say, well, let's get you on thyroid hormone, which will probably stop the heavy bleeding, and let's get you on progesterone, which will help correct the too much estrogen problem, which is making you grow the fibroids in the first place. But let's say you already had hysterectomy, okay, and you still have your ovaries. You will still go through an earlier menopause, because when you take the uterus out, you cut one set of arteries to your ovaries. You still have another set, but you will go through an earlier menopause. And those women will need estrogen, and they'll need estrogen, maybe, they'll need progesterone, probably, and they may need testosterone. I can't predict for any one woman what's going to happen, because each of us is an individual. But if you have your ovaries taken out, most of the OB-GYNs will put a patch right on you. Will put an estrogen patch on you because they know that you need the estrogen. They'll say you don't need progesterone, and they may eventually put you on some testosterone if you complain loud enough. Yeah. Now, are you a candidate for going on hormones now? Okay. You've been 35 years without hormones. A conventional doctor is going to say it's going to increase your risk of having a heart attack. Well, if you swallow your estrogens, that's right. What I can tell you is that there are many physicians like myself who work with older women who have been off of hormones for a long time. And we kind of sprinkle the hormones on your body just a little bit, okay? And for many women, it changes their lives because they feel so much better. I am not a Suzanne Summers doctor, okay? I'm not trying to get y'all's hormone levels back to where you were when you were in your 20s, okay? I'm not a Wiley protocol doctor, okay, which pushes your hormones back to where you were in your 20s. There's no reason for older women to have hormone levels that would allow us to bear a child.
I wouldn't even move.
Yeah, you don't need them. You don't need them. But some hormones, as we get older, reduces our risk of cardiovascular disease, helps us keep our bones strong, reduces our risk of dementia, and enhances our immune system. So I'm going to go back to the Women's Health Initiative for just a minute. Everybody heard the results that hormone replacement therapy causes strokes, 35% increased risk of strokes, and they shut down the study. Okay. What they found 10 years later, that was published back in 2012, was that the women who took Prem-Pro, and I fear that this is going to be true also for women who are on birth control pills. The women who took Prem-Pro, greater risk of heart attack, greater risk of stroke, greater risk of deep vein thrombosis and clots, greater risk of breast cancer. Even after they stopped the Prem-Pro, these women still had a greater risk, up to 10 years later. Those women were damaged by the Prem-Pro. I mean, Provera should be taken off the market. It's just a bad, bad drug. No one should do it. Do not get Depo-Provera. Don't do it. The women who were just on Premarin, these women were on estrogen. Most women here are scared to go on an estrogen, right? Because it's going to increase your risk of breast cancer. No. The women who were on Premarin had a 23% lower chance of getting breast cancer, period, end of story. If they got breast cancer, it was a milder version of breast cancer, and they had a 68% better chance of surviving it than the women who were on placebo. The women on placebo got more aggressive breast cancers. And they had a 30% reduction in all-cause mortality. So they didn't die of dementia. They didn't die of heart attacks. I mean, there are other things they did not die of. So get rid of this idea that estrogen is bad for you, okay, that it's dangerous. It is not. I mean, why would women's bodies be filled with estrogen if it was bad for us? Women don't get heart attacks or strokes or things like that unless they smoke before we go through menopause. It's after menopause that we start having accelerated aging. So the hormones are good for us. You just have to know how to take them and take them the right way.
That's where they scare the ladies.
Yeah. Oh, they scared them. They scared the physicians. Physicians didn't understand what was going on. But what's really interesting, and I pointed out in my article on progesterone, is that 80% of physicians who are female, or physicians' wives, okay, 80% of them did not stop their hormones. The public, almost everybody stopped. It was a huge number stopped. So, yes?
Is there an age limit that you would have to stop hormones?
No.
As long as you keep breathing.
Right, that's good to know.
Yeah,
You know, some
no.
people think, oh, because now I'm not in menopause anymore and I'm 68,
No.
I should stop.
Well, it depends. There's some women who are going to sail through menopause and not have any problems at all.
Right.
Okay, they're going to do just fine. They tend to be heavier. Again, when you go through menopause, it is basically a stress test on your adrenal glands.
Okay.
So if your adrenal glands have some reserve, they can crank up and make more building blocks that can be made into estrogens out of your fat. Okay? Your testosterone will drop off much, much more slowly than estrogen does. So that's why many women, as their estrogen drops off, they'll start getting more facial hair. You get more mustaches, you get more sideburns. Okay? And women don't like that. It's because your testosterone level is still higher, relatively speaking, than your estrogen level. Your estrogen level's dropped off. Okay? So you can fix that. You can put estrogen on your face. There are estrogens you can smear on your face and get rid of that. You can take saw palmetto that will block the tendency to get facial hair. Okay? So some women, they'll do just fine. Okay? Other women will have some hot flashes and night sweats, not be tolerant to it, not feel good. And they can go on black cohosh, they can go on kudzu, they can go on red clover, different kinds of herbs, things like that raise their estrogen levels some, okay, or act like estrogens, and they do just fine. And then there are women whose brains just don't work without the estrogen. And typically they will have more hot flashes, more night sweats, and they come in and they're just, I'm not myself anymore. Okay, I want myself back. I can't function anymore. Those are the women who, they're gonna be on estrogen for the rest of their lives, with progesterone and probably testosterone.
Okay.
Yeah.
Now tell us about other guys, which testosterone goes down and the estrogen comes.
Well, and the bigger your stomach, the more estrogen it'll go up. And the more alcohol you drink and the lower your zinc levels, the more your estrogen will go up. And having too much estrogen can also cause problems with erectile dysfunction, and can also contribute to accelerated aging in men. Guys need more testosterone than estrogen.
And the breast.
And you'll get some breast development. Yeah. Yeah. You'll have a nice full head of hair if your estrogen's high then. You'll have a nice head of hair. Okay? So men who have very low body hair and have lots of hair up here, okay, they're at increased risk of getting prostate cancer because it's the estrogen, not so much the testosterone, that actually causes or feeds the prostate cancer. Okay? All right, let me see. So, if you're going to take testosterone, and there are a number of different ways. I mean, I have a few women out there that basically just want testosterone for urinary incontinence, okay, when they talk to me about it. And they don't want to do estrogen because they've heard bad things about estrogen, and they don't want to do progesterone, and et cetera, et cetera. So I've got a few gals who are on it just for that, and also I have a few gals who are on it just for I want better sex. Okay, And what I'll do with those women is I will give them testosterone combined with a very, very weak estrogen called estriol. And the vagina is exquisitely sensitive to estriol and testosterone. Testosterone is what helps you get wet when you have sex. It doesn't help with reducing vaginal moisture while you're walking across the room to take care of somebody. Okay, I mean, if you can feel yourself down there walking across the room, you need some estriol. Okay. So estriol and testosterone is, I don't prescribe testosterone basically just by itself. I always prescribe it usually with a little bit of estriol because I'm primarily working with menopausal women. Now, let me back up a little bit. I can also give women who are on birth control pills. Okay, their ovaries will get shut down because of the birth control pill. So they may not be interested in sex at all. So I can give them testosterone. All of those groups of people, they'll apply the testosterone to their genitalia, and they can put it on once or twice a day. They can put it on, depending upon the effects that they're looking for, they can take more of it like closer to the weekend. So if you're going to have sex, once you use it every day until everything feels normal down there. And then women will say, you know, I'm not noticing quite as much improvement in sex as you described. I'm not dry, I'm getting wet when we get excited, but you know, it's just not quite there yet. We can either increase the dose of the testosterone, which is okay, or she can take more of the testosterone when she needs it, which is just before she has sex. And so frequently, I'll have women, instead of using the testosterone just once a day, every day, I'll have them skip it Monday, Tuesday, Wednesday. I'll say, when are you gonna have sex? When do you and your husband have sex? And it's usually on the weekends. And I'll say, okay, then so why don't you take it twice a day on Thursday, Friday, Saturday, maybe Sunday morning. Sunday morning, would that be good? Yeah, that's good. Okay, okay. So you collapse a whole week's worth of treatment into just a couple of days. That way her testosterone level goes really high, okay? She's gonna get much more benefit about increased sensation and desire for sex. And then she doesn't take it for a few days. So you wouldn't want to take that every day because she would probably then start complaining about symptoms of excess testosterone. And the first symptom that women tend to get of excess testosterone is going to be acne, right here where a guy gets a beard. But it may be on your chest, maybe on your back. Okay, now if you ignore that, then you'll start getting more facial hair. Now if you ignore that, then your voice might get lower. You ignore that. Okay.
Start busting.
If you ignore that, then your clitoris may get larger. Okay, so basically you watch for the acne, okay? And if you start getting acne, you're either taking too much testosterone or your body hasn't seen testosterone in a long time, and half the dose, quarter the dose. Take just a little bit of it. Let your skin get used to it, and then you can increase the dose. So I have all women who I put on testosterone use a very little bit down there, and then slowly increase it over a couple of weeks. And that's how you find out, okay, what can you tolerate. But if you go to the maximum dose the first week because you got a hot date this weekend, we're gonna get zits. So don't do that. Okay. But that's what we watch for. Now, you can also lose hair on the top of your head if you get too much testosterone. You can lose hair at your temples. Now, we like men who have some hair loss at their temples. Women intrinsically say, he's sexy, okay? If we see a man who's got completely round like this, okay, hairline, they look boyish to us. And that's because they don't have enough testosterone to get the temporal hair loss up here. Okay, so women can lose hair there too. So that can be a sign of your skin being too sensitive, and you may not want to push the testosterone dose higher, or you may have to get some saw palmetto, which will block that. Does that make sense? Is this helpful?